Hi, my name is Kirsty McLeod, and this is a poster about my pre-doctoral journey looking at difficult IV access. The arrows at the top illustrate my research journey, which began in 2018 when I was awarded time via a research secondment to look at difficult IV access, known in the literature as DIVA, where patients experience repeated and failed cannulation attempts, causing pain, distress, and delay in treatments. I found evidence that predicting people at high risk of DIVA may reduce repeated failed cannulation attempts, and a systematic review showed with high certainty that ultrasound-guided cannulation improves chances of cannulation success in patients with DIVA. This led to an unsuccessful pre-doctoral application, but then a successful one-year internship with the ARC evaluation theme in 2021, and then a successful pre-doctoral application in 2022. The boxes above the arrows show my research journey, whereas the ones below show my clinical journey. Both have complemented each other and have helped me to get to the point I'm at now. At the beginning of my pre-doc year, I started to work with my new academic supervisors, Jo Dunville and Michelle Briggs, who got to work trying to help me organise my thoughts and ideas. I knew I wanted to look at what we could do to improve the DIVA patient's experience, but I wasn't clear where to start. Reviewing the evidence, it was clear that there was lots being done to answer this question, but as yet, no one had summarised the evidence-based interventions that could help patients. I needed to do this to understand where the gaps in evidence were. I got to work on preparing a protocol for a scoping review, which then quickly became a systematic review of clinical practice guidelines, only to find fairly early on, thankfully, that this had already been done and had recently been published. The systematic review of clinical practice guidance by Patterson et al. Suggested early identification of DIVA, escalation for expert help, and the use of ultrasound-guided cannulation could improve patient experience. However, they found little evidence of utility, the implementation methods, and acceptability to clinicians and patients in their systematic review. They concluded that identifying clinical staff who can deliver specialist techniques such as ultrasound-guided cannulation, or the implementation of specialist teams who can support this pathway, could be difficult and costly. Maybe this was why practice wasn't changing. So it was clear that evidence and clinical practice guidance did exist, but we weren't utilising them locally. And from talking to colleagues and friends and family with direct experience of healthcare and other trusts, patients with DIVA were still getting a raw deal. But anecdotal information isn't enough for a PhD application. So we looked at how we could find out what was happening nationwide in other trusts and what barriers to implementation might be. We decided a survey may give us this information. I devised a survey in Qualtrics and we sent this out via social media and professional forums. I've had 96 responses to date and we'll be giving it one last push at the IPSIV conference at the end of November before I close the survey to get analysing the data. We hope to gain a greater understanding of the barriers and facilitators to best practice for DIVA patients to develop an implementation study for PhD. I have learned so much over the past year, both research skills and the less obvious soft skills that have had an impact on my research progression, my career development, and most importantly, patient care. Thinking and writing at PhD level has been a learning curve. Being able to articulate what we know, what we don't know, and what we need to find out took longer than I anticipated. Utilising the critical appraisal skills learnt last year and a helpful steer from my supervisors helped develop my research thinking. My supervisor's guidance has hugely shaped my ability to understand this process and helped me to write a survey protocol, which I received very positive feedback for. I learnt about questionnaire development in Qualtrics, working out if the questions I'm asking will get the information I need from the survey, thinking about how it might be analysed, piloting the questions with people who know the subject area and those who don't. Navigating ethical approvals to get an ethical exemption was also a learning curve. Again, thanks to supervisors and pre-doc fellows going through the same process, it was made slightly easier. I conducted PPIE, preparing for and talking to patients about my research ideas and the work I am doing. How to present myself as a researcher rather than a clinical nurse to both patients and staff who know me well required some thought. I'm currently learning to use SPSS and thinking how I will analyse the data is next on the agenda. We've had a teaching session on how to use it, and my SPSS survival manual should help me in going forward. Soft skills I've learnt include being adaptable to change in plan during the pre-doc year, being open to feedback and improvement from my supervisors. There is often a lot of comments on my work, but working through them has developed my work and my research thinking. I think I'm a better researcher for it. The internship and the pre-doc has given me the opportunity to network in my trust and in the wider DIVA research community, including internationally. I've got to know many nursing, medical and AHPs throughout the trust who are as frustrated as I with the current processes. I have linked with clinical leads and researchers of DIVA who are interested in the work I'm doing. Some respondents of the questionnaire have contacted me independently as they are having similar issues in their trusts. The more I talk to different people, the more certain I feel that this area of research is important and the more my thoughts about the research develops. Developing a greater understanding of DIVA research has enabled me to speak with confidence to clinical staff and senior leaders in our trust. I've been able to develop my role in the organisation as the DIVA lead, and have started to work on projects that I hope will improve the experience of patients with DIVA. Which leads me on to the impact my pre-doc work has had so far. As the critical care outreach team of a 24/7 service and are already being used as the expert cannulators out of hours, I thought we were best placed to learn the skill of ultrasound-guided cannulation first. I convinced my manager it was a good idea, and we bought a portable ultrasound device that connects to an iPad. I asked our line team to train me up, and I've since started to train others in our team. There has been teething problems along the way. Time to train is an issue. It is a difficult skill to learn, and not everyone is quite as excited about learning this new skill as I. But we are making progress, and some patients are reaping the benefits of having ultrasound-guided cannulation, experiencing less attempts and reduced delays in treatments. I've been working with outpatient systemic anti-cancer therapy team to introduce ultrasound and embed vein assessment in their practice. We are doing a quality improvement project to show the benefits of ultrasound and vein assessments to patients attending for treatment. Finally, I will have a new role in January 2024, focused solely on improving processes for DIVA patients, with protected time to complete my pre-doctoral work and submit a PhD application in June 2024. And finally, I'd like to thank Jo Dunville and Michelle Briggs for their support and guidance throughout the past year and their continued support and guidance. And also thank you to the pre-doc fellows that have helped me along the way. Thanks very much.